speculum.
Oh, speculum.
We have nasal speculums to open our nostrils. We have vaginal speculums. And we have rectal speculums, right? But we call this a proctoscope.
Okay, so this entire thing here is for a pap smear.
Yes.
All of that.
Well, this is for culture.
Right,
If
if
she
they
has
want to culture.
vaginitis and we've got to do a culture,
Mhm.
this is for bacteria. This is for a virus. This would be for yeast. And these are DNA probes. This is what, I want to show you what the guys looks like.
DNA?
Yeah, so if you're looking for sexually transmitted disease, this is what goes up a guy's urethra.
Ooh.
No, look at how tiny that is.
I was gonna say it's not, I thought it was.
Oh my God, it's not like this, you know?
Okay, but-
It's this itty bitty wire.
But you use this.
That is, we use that
'Cause I
around the
never watched-
cervical.
Instead of scraping, right?
Yes, you just kind of twirl it in the cervix. Let me put this back and I'll demonstrate. Okay, so if this is a cervix, what you do is you come in here and you just kind of twirl it.
Uh-huh.
It just gathers endocervical and cervical cells.
Mhm.
And then you put this in here, you open the bottle,
Mhm.
obviously, kind of swish it in there, and then you can break it off at this level or this level.
And
That's
then you
what
leave
that's
it in
for.
there.
And then you just close the lid. Make sure you have the patient's last name, comma, first, date of birth, last menstrual period on that. Okay, so that's the thin prep. This is the old-fashioned kind of pap smear. And what you do is you actually hand the doctor this side. So he would take it from you, and then he would come into the cervix. This deep end goes endocervical, and you just scrape around here. Okay, that wasn't very smooth, but then you as the medical assistant are holding the slide for him, okay? This part comes off. And you gotta hold it good, because he could knock it out of your hand. What he's doing is he's wiping mucus secretions on that slide, and then he kind of throws that at you. And then he takes either the swab, or he takes a little brush and goes in endocervical, really in there. And same thing, he's gonna use that same slide and wipe those secretions on there. Now, and then he throws that
Is
at
the
you.
same slide?
Yep, same slide. I know they talked about 3 different slides. Then you've got to preserve those cells, and you can do that with this Cytology Fixative, or you can spray it this way. You just don't want to get too close because it can blow the cells off of it. So you just want to kind of do it from a distance, or you open this up and just kind of drip some of it on
Is
there.
that powder?
That's a liquid. And then you just want this to dry on the tray for about 10 minutes, okay? Then once he does the pap smear, then he's gonna take a little KY jelly, he's gonna do a vaginal exam. So he's got 2 fingers in usually and he's palpating ovaries, okay? If it's an older woman, he comes out and he'll do a rectal exam on her. So you'll wanna make sure you have a hemocult available. You don't need this because he's just going to wipe the stool from his exam glove, you know, on your windows A and B, okay? And then you're gonna develop it on the back side, right? So that's for older women, usually 50 and over, okay? Younger women don't have to have that. Okay, so if it is the metal speculum, we have it in a hot bowl of water, because nothing worse than cold
Yeah.
metal. All right, the plastic is a nice option, and like I said, it usually has a light point that attaches, so you can see inside that whole vaginal mucosa, and because, you know, this is obviously see-through, where you're missing part of that vaginal mucosa with the metal. But this one you have to be careful, sometimes these ratchets pinch. That's the only downside. The nice part is you throw it in the trash, it's done. This one, you've gotta go in and you've gotta sanitize it first, right? Remove any tissue or debris, and then you've gotta sterilize it. They usually have hot sterilizing beads that you just put it in. Doesn't usually have to go in an autoclave because it doesn't have to be sterile. It's never sterile down there, right? Because of what bacteria? Bacteria down there. Come on, sounds like. Yeah, good. It's just down there all the time, right? So it's very easy to get moved forward into the vagina. If you have a urinary tract infection, what's the first bacteria that comes to mind? E. coli. It may be something else, they'll culture it, but it's usually E. coli, so that works really well. Questions on that? You have 2 sets of gloves, one for the doctor and one for you. If the doctor's doing a prostate exam on a gentleman, he usually only wants 1 glove, okay? Gentleman drops his drawers and he just comes in and checks the prostate. If he's gonna have the patient on their left side, knee, chest, and he's actually gonna pull the cheeks apart and use the scope, then we'd want 2 pairs of gloves. No, we'd want 1 pair of 2 gloves. So he's got both hands covered. But most of the time, he doesn't like you wasting a glove, okay? Questions? All right, we'll test on that Monday.
So, but really, this is what they use nowadays.
That's what they're
I
using.
mean, not
Some of
They
us
still
still
use
use this.
Yeah.
Really?
I got
Yeah.
it done like a month ago and that's what they use, old style.
Yeah.
Okay to go?
Yeah,
But the kids want
okay. Any questions? Okay, let's go home.